Women with breast cancer are twice as likely to die early in some areas of England than in other areas, a damning report warns. It also reveals how 4 in 10 patients are being diagnosed late in certain health trusts, partly because GPs are missing symptoms. Experts blame a lack of awareness among family doctors, who mistake the early signs for back pain, depression or even heavy drinking. One woman said she was made to feel like a hypochondriac for repeatedly going back to her doctor, only to be sent away again. MPs on the All Parliamentary Group on breast cancer warn of a postcode lottery in diagnosis and care. In Newark and Sherwood Clinical Commissioning Group, CCG, in Nottinghamshire, an average of 31.9 people per 100,000 die from breast cancer before they reach 75. This is more than twice as high as in Tower Hamlets CCG in East London, where the rate is 13.3 per 100,000 people. Although there are many reasons for this variation, health officials in Tower Hamlets have been working hard to improve early diagnosis and screening. Jill Goodrum, pictured with her daughters Amy, 8, and Grace, 3, died 3 years after doctors misdiagnosed her breast cancer as tennis elbow. A mother of 5 died 3 years after doctors misdiagnosed her breast cancer as tennis elbow. Jill Goodrum, 46, went to her GP in 2011 when she was unable to lift her arms above her shoulders. Doctors initially dismissed her symptoms until she discovered a bone-like lump near one of her breasts in 2013. By the time the grandmother, from Plymouth, was diagnosed with terminal breast cancer, the disease had spread to her lymph nodes and liver. She started chemotherapy in October 2013 and continued to receive treatment until she died of septicaemia in May 2014. Writing on her blog, she said, "Being diagnosed with cancer was horrendous. I'm never going to get old. The fact that I have 2 small children is very hard to deal with too. I'm never going to see them grow up. They are going to lose their mummy. My older children are obviously traumatized, but they are very supportive." In Gloucestershire Clinical Commissioning Group, 38% of breast cancer patients were diagnosed late, at stage 3 or 4, the group's report found. These late stages are when the tumor has spread to the surrounding tissue or organs and is much harder to treat. Yet in Rushcliffe CCG, in Nottinghamshire, only 12% of patients were diagnosed at stage 3 or 4, with the majority diagnosed at stages 1 or 2. Across England, up to 21% of women who previously had breast cancer were initially overlooked by GPs when the illness returned. One woman was sent to an osteopath for back pain, while others were diagnosed with depression or indigestion. Only 71% of patients aged 50 to 70 took up their invitation for a mammogram in 2016-17, down from 74% in 2006-07. Breast cancer is the most common form of cancer in the UK, and up to 1 in 8 women will develop it. In a joint statement, Labour MP Thangam Debonair, Tory MP Craig Tracy and SNP MP Dr Philippa Whitford said, "Our inquiry has uncovered a concerning postcode lottery in screening uptake, early diagnosis and access to breast cancer services." This variation in NHS services can have a devastating impact on patients' lives and must be addressed. NHS England said, "Cancer survival rates have never been higher, with more than 7,000 people now surviving after successful NHS treatment compared to 3 years ago, and we are already addressing the issues raised by this report."